it's Dr. B here. Hope you're having an amazing day. It is September, and that is the time that we shine the light on sickle cell anemia or sickle cell disease, as some of you have heard it. Sickle cell disease affects millions of people worldwide, especially African American people, Hispanic, Middle Eastern, and Mediterranean. So let's take a moment and talk about sickle cell disease. What is sickle cell? Sickle cell disease is a genetic blood disorder passed down from both parents to their child. Okay? So what happens in sickle cell is the normal, round, flexible blood cells, they are misshaped. They are rigid, they're hard, not flexible, and they are shaped like C's or sickle shape. Okay? And because of their abnormal shape, these blood cells get stuck in the blood flow system, causing pain, all kinds of problems, including strokes, infections, chronic health conditions. But pain is the most common thing that we see with patients with sickle cell disease. Blood cells get stuck. When those sickled blood cells get stuck, they cause severe pain, and we call those pain crisis. Okay, they're called pain crisis, and that's usually what brings a patient with sickle cell disease to the ER. They're in severe pain. Now, these sickle cells can cause, like I said, anemia. They can also cause organ damage. So the red blood cells are not normally supposed to be sickled. So think about it. Anything that's abnormal is going to cause problems. So who is affected by sickle cell? I already told you the nationalities, but I want you to know that about 100,000 people live with sickle cell disease in the United States. And here's another very important statistic. 1 in 13 live with sickle cell trait. Now, let me tell you what sickle cell trait is. Sickle cell trait means that the person with the trait is a carrier of the gene. So what happens is, let's talk about how sickle cell is passed on. So you have to have both parents have to have the sickle cell trait in order for their offspring to get the sickle cell disease. Okay? So if a person has sickle cell trait, they're just a carrier. If I'll just say, if that person doesn't mate with a person with the trait, then they'll never create an offspring with sickle cell disease. I hope you understood that. Okay, so you have sickle cell trait, you're carriers of the gene, but in order for that gene to express itself, it must be combined with another sickle cell trait to get the sickle cell disease. Let me say this. People with sickle cell trait usually live a normal life, no issues whatsoever. Okay? Now, I know I've heard very rare stories of people with sickle cell trait having some health issues, but never the disease. So, how do you treat sickle cell disease? It's treated with a variety of things. Usually we treat the symptoms. The pain crisis, which is very bad and debilitating, we treat it with opioids and narcotics, morphine, and even some other opioid drugs. If they're having chronic infections, they're on a prophylactic antibiotic to keep their risk factors or keep the risk of getting an infection down. We also have them stay hydrated because that's key. Staying hydrated. You can't get dehydrated because the blood already clumps when you're dehydrated. So now these sickle cells are clumping. They're going to lead to a pain crisis. We also use oxygen to feed those blood cells. Um, the main thing that I've seen in practice is the pain. So because of the sickle cells, in children are born with this disease and they start having issues almost immediately. Okay, they are discouraged. Children are discouraged from participating in sports where they got to be running, jumping, and doing all the things. So no football, basketball, soccer, baseball, none of that. Okay, because it's physically exerting. So these children are encouraged to participate in debate, chess, those kinds of things. Okay, be scholars. I mean, we should be, all our children should be scholars, but yeah, no sports. So there are some promising treatments. So we use Motrin for mild pain, Tylenol maybe sometimes, Tylenol number 3, a narcotic for moderate pain and severe pain. We do use the heavy hitters through IV or even some PO meds. So meds that they take by mouth. So those are some treatments that we use, but there are some other treatments. Hydroxyurea, Endari are some drugs that they use to treat sickle cell disease and the issues that are associated with having the disease. Now, I saw my textbooks changing, I want to say about 10 years, between 8 and 10 years ago, because they always say there's no cure for sickle cell. There's no cure. Just, it wasn't no cure. But I'm happy to say that there is a cure for sickle cell. And I read some studies down at a hospital in Chicago, I want to say, that we're doing stem cell transplants. That is the cure. But and that's promising and that's good. But the sad part about it is that stem cell transplants are not covered by insurance, which makes it um, inaccessible to, of course, children or families that don't have the money. So that's the bad thing. There is a cure, stem cell transplant. So I did see my textbooks starting to change with that information. And you can look it up. The studies, go to Google Scholar and go to stem cell transplant for sickle cell. And the studies will come up. Very promising. Yeah. So I think it's important for us to um, raise awareness. Um, how can the community support, or how can you support? I've seen this professionally and personally. And because sickle cell is so debilitating, um, patients with sickle cell, they need a lot of support financially. So I think if you know somebody, give. I saw somebody trying to raise money for their stem cell transplant. I don't even know the person. It just popped up. I gave. And I'm following, and they, last time I looked, they had a couple of $100,000. I don't know where it is now. But that stem cell transplant is very expensive. So if you see one, support. If you see somebody raising money or raising funds to try to get one, support. That's how we can support. Another way we can support people with sickle cell is show some compassion. I've seen, in the healthcare setting, I've seen it outside the healthcare setting. Like, oh, they just want some drugs. They drug seeking. No, you can't say that. Pain is whatever the person says it is. And we have to show some compassion because it's very painful. And so show some love and compassion during this month of sickle cell awareness. Um, Share my video, share my graphic that I have on social media, educate somebody about sickle cell. Look at ways that you can support. Here in Houston on Saturday, the amazing 5K, the sickle cell walk is happening. I do it every year. It's going to be at McGregor Park. So search it and join the walk. Even if you don't want to walk out, get out and walk. Make a donation to help somebody with sickle cell, to help the research, support somebody if you can find somebody that you know this month. Just reach out to them and say, I just want to give you something to help you. Even if you don't know if they have a need, just give and just let them know that you're thinking about them this month and that you care. Sickle cell is debilitating and this can be very bad. But I also want you to understand that if a person with sickle cell disease takes really good care of themselves, they can excel, they can thrive, and they can live well. Okay, even with the things that are associated with having sickle cell, they can still live productive lives. All right, y'all, it's Dr. B, and I just want to talk to you a little bit about sickle cell disease on this month of sickle cell awareness. I hope this was informative, and we'll be talking soon. Bye for now.